Good afternoon. My name is Ariella Jonas, and this afternoon I am discussing with you how a needle exchange program will impact the opioid epidemic. More Americans died from a drug overdose in 2017 alone than died in the entire Vietnam War. That's approximately 70,200 people, according to the Drug Policy Alliance and the CDC. That's 70,200 people that died in one calendar year, compared to the entire Vietnam War that lasted about 20 years. We need to find solutions to this epidemic. Families are being torn apart. Mothers, fathers, siblings, friends, and children are being killed during this epidemic. Everyone knows someone who's been impacted by the disease of addiction. So what is a needle exchange program? Needle exchange programs freely offer clean hypodermic needles to drug users in an effort to reduce the spread of disease, as well as expose drug users to services such as treatment referrals, healthcare, and education. July 2nd, 2019, the Palm Beach County Commission approved a needle exchange program in Palm Beach County. Palm Beach County is the second county after Miami-Dade County to approve a needle exchange program. Despite a lot of fear and stigma around disease of addiction and certainly needle exchange programs, there are benefits. A needle exchange program in Palm Beach County would reduce the spread of bloodborne diseases and decrease the number of drug users by providing education, connecting with resources for recovery, and support services. Needle exchange programs also decrease the number of dirty needles being reused by drug users, thereby reducing the number of dirty needles left on the street. Needle exchange programs are cost-effective in comparison for treatment of HIV and other bloodborne diseases. And needle exchange programs provide access to complementary services such as HIV testing, naloxone, and entry into rehabilitation programs. Needle exchange programs have been researched for over 30 years and demonstrate, according to the CDC, that they play an important role in reducing the transmission of viral hepatitis, HIV, and other infections. Recently, there's been an increase in HIV infections among white injection users, which coincides with the opioid epidemic. By using clean injection equipment, the spread of diseases such as HIV, Hep C, Hep B, and skin infections is decreased. Also, needle exchange programs are cost-effective in comparison to the treatment for HIV and other bloodborne diseases. So according to the CDC, the estimated lifetime cost of treating one person living with HIV is near $450,000. Also, according to the CDC, hospitalization in the U.S. due to substance-related infections alone costs $700 million annually. And treatment for hepatitis C costs $15 billion annually. According to a study published by the Public Library of Science in 2019, the cost of a needle exchange program can range from $400,000 for a small rural needle exchange program serving about 250 clients per year to upwards of $1.9 million for a large urban needle exchange program serving 2,500 clients annually. The cost of a needle exchange program is significantly less than supporting health care for any of the more serious chronic illnesses users are exposed to through utilization of used injection equipment. Needle exchange programs also decrease the number of dirty needles reused by drug users and reduces the number of dirty needles left on the street. So needle exchange programs offer an environment where drug users can exchange or obtain clean needles to inject drugs. By offering a location to obtain injection equipment, drug users are less likely to use needles found on the street or share needles with other injectors. Providing injection users with a designated location to bring used equipment reduces the amount of used needles left for unintended recipients to find, such as children. Needle exchange programs also provide access to complementary services such as HIV testing, entry into rehab programs, and access to services and medication-assisted treatment such as naloxone. So if a user attends or goes to a needle exchange program, they can receive a direct referral for alternatives to substance use, such as detox services. They can also be referred to drug treatment and also referred to providers of medication-assisted treatment. Needle exchange programs may also provide users with access to naloxone, which is an overdose reversing drug. And needle exchange programs may also provide healthcare services such as HIV testing, hepatitis C, and referral for treatment of other infections related to drug use. Finally, needle exchange programs can also provide education about safe practices if people are going to continue to inject or use drugs. In conclusion, needle exchange programs reduce the spread of bloodborne pathogens, offer an entryway for substance abuse treatment services, and reduce public spending on more costly health consequences of injection use. Contrary to some beliefs, needle exchange programs are safe, effective, and cost-saving, and do not increase illegal drug use or crime. Needle exchange program in Palm Beach County would reduce the spread of bloodborne diseases, decrease the number of drug users by providing education, and connecting them with resources for recovery and support services. Outreach and community-based services promote engagement with substance users who may not otherwise be willing, able, or aware of assistance services. I hope this presentation has helped you better understand the importance of supporting a needle exchange program in Palm Beach County.